Thank you so much, Vincent. And hi, everybody. I hope that wherever you are, you're well. I know for some of you, it's afternoon or it's later in the evening. Some people, it's very early in the morning. So I want to welcome you all. And I want to thank the team from the Civil Society Coordinating Group that has been able to put together this webinar. It's been quite a bit of work behind the scenes, ensuring that we can talk about data resources for advocacy. It's a webinar series with 2 sessions. So today we're having our first session that's focused on the GFF Data Portal. And I want to just quickly share about what is the thinking behind this webinar series. I think all of us are increasingly talking about advocacy that is informed by evidence or that's backed up by data so that we can build strong case for either advocacy or our accountability work. And the thing is, it's important for us to really use credible data resources or data sources. And the webinar today has a focus on enabling us as advocates, as people who are engaging at the country level, to be able to utilize these tools that are available globally to back up our work and to strengthen the calls that we're making to our government and to other partners that we work with. But before I go into the specific objectives of the webinar, I don't know whether Vincent, you can be able to put that up for me. If not, we can simply walk through them. I want to thank the team from PAI, who is our NGO host for this Civil Society Coordinating Group. I also want to thank Path colleagues. I'm not the only one who's been part of this team. The team from Countdown 2030, the team from the GFF Secretariat, as well as Global Health Visions, WHO, for really putting efforts into designing this series of webinars. It's been quite a bit of work behind the scenes for us to ask what really makes sense for us to be working with. So that's a team that's put this together. And as part of designing this webinar, we were very clear that these resources or data tools that we are sharing do not replace the national data systems. They're simply able to support you with additional data and for you also to look at what else is out there that can really back up your ask. So this isn't meant to replace the DHS or the HISs that you use, but it's complementary data that will help you to augment your case with your decision makers or with the other partners that you're working with. So let me share the objectives for the session and then I'll introduce the team from the GFF. So really we wanted to increase awareness and access to data resources and tools that support evidence-based advocacy for reproductive, maternal, newborn, child, and adolescent health and nutrition, and particularly in GFF countries. And I think if you look at some of these tools, they have more than that. The GFF portal has largely focused on the GFF countries. In terms of specific objectives, we want to orient all of us to the several different resources that provide multi-country data and evidence to advocates, but also to other stakeholders at the national level, and also discuss the role of data and evidence in supporting our advocacy and accountability work. And then as we keep having this conversation, to explore the appropriate use cases for the different data resources and tools to increase access by those of us who are at the country level. When we talk about use cases, what we really are thinking about is to ask what tool is appropriate for what piece of work? What tool contains the data you need for X, and what tool will back you best for Y? And then, of course, we'll round off by sharing a simplified matrix that has a quick summary of some of the tools that we'll be covering, and you can be able to use that matrix and also share it with other colleagues in our sector. So beyond this webinar, feel really free to share this information with others so that we can move forward. So with that, I want to turn this to the GFF team. I hope that Karin Gishuhi, you're on, and I want to hand this off to you, and I'll ask you to walk people through. Is Karin in? Karin, thank you so much.
Hi, Pauline.
So, hi, Karin, how are you? So I want to ask you to come in. I know you're the lead for this series from the GFF side. Two quick things. One is walk people very briefly through what you'll cover, and two, take on and lead the meeting. And when you're done with the presentations, we'll have a session for questions. So prepare your questions, your clarifications where you need things. You can use either the chat function or you can even raise your hand. We'll provide an opportunity for people to raise their hands. So over to you, Karin. Thank you.
Great. Thanks so much, Pauline. I'm just going to share my screen quickly. Oops. All right. Can everybody see my screen? And by that, I mean, do you see? Let me undo my screen share. Let's try this. I'm going to try one more time, Pauline. I'm a Teams girl. I don't use Zoom that often.
You might want to go to projection mode so that we can only see, we don't see the note slide.
Yeah, the tricky bit is I had another monitor connected. So what I'm going, oh, there we go.
Yeah.
All right. Now, does that look better?
Great.
Okay, wonderful. Thanks so much. Well, good morning, good afternoon, good evening to all of you, and thanks so much for joining. We were excited to hear from Pauline that we were being asked to share a little bit more about the GFF Data Portal, in part because the jumping off point for this portal is from the country level. And what I mean by that, today we're going to talk a little bit about how the GFF has partnered with our countries to help them, advocates like yourselves, donors, the GFF Secretariat, and any external stakeholder better understand how a country is progressing towards achieving the objectives of their investment case. So for those of you who are familiar with the GFF engagement, we work really closely with countries to develop an investment case that acknowledges the fact that countries already have a health sector strategy, or they already have an SRMNCAH-N strategy. And what people really struggle with is the prioritization of those strategies. We're looking at two things. We're looking at available resources and the list of priorities that a country has to achieve its health outcomes for women, adolescents, and children. And so all of that takes a lot of engagement, a lot of alignment with other donors and stakeholders such as yourselves. So for those of you who work in a GFF country, you may be a member of what we call the country platform. And this group of individuals may exist in country already as a technical working group, but we really support countries to bring in the voices of CSO advocates and youth, private sector, and other stakeholders to be a part of any conversation, ideally focused on the data. And one of the ways we support countries in doing that is we provide a lot of partnered TA in country to strengthen data collection, curation, analysis, and use. And we also leverage the data portal that we're going to show you today to help any audience member, I'm saying audience member, but any stakeholder be able to understand not just what's going on at the national level, but at subnational level. And I think the theme for this portal could in part be about equity. In all of the countries we partner with, there's a focus on most at-risk populations. And the best way to understand what's happening at country level is to go beyond the national data and look at the subnational. So with that, I'm just going to walk through a few slides of introduction, and then we're really just going to spend the most amount of time going through the portal answering some of the questions that I imagine many of you might have while working in country and supporting your communities. So the data portal objectives were really three. Number one, we wanted to create accessible dashboards that visualize the country and program level data across output, outcome, and impact indicators. The goal, again, is to enhance data use. So by packaging it in a visual way, it helps anyone understand what's happening and where. We also wanted to provide a secure storage for the data across what we call the GFF logic model. And we'll talk a little bit about that as well, what our overall theory of change is. But we'll show you the type of information that we keep in what we call this repository, combined with the information shared from our partner countries. Importantly, we see this as a way of bringing together all different types of data in a single place. So you'll see on each country profile page, population-based survey data, process data, what does the GFF engagement look like, health financing, resource mapping and expenditure tracking data, and the country's routine data. Essentially, we want to also streamline reporting processes. So the GFF ideally isn't supporting a very burdensome reporting process. We're really asking countries to send the information that they've prioritized to best monitor the implementation of their investment case. So the other unique piece about this portal is when you're on each country profile page, you will see different indicators for each country. That's because this is a country-led process. And while they're all focused on improving the health outcomes of women, children, and adolescents, they use different indicators to measure that success. So with that, I'm going to introduce you briefly to what we call our GFF logic model. And this is really talking about how we're deciding what needs to be measured. And this is a theory of change that the GFF has put forward to say that we assume with these core inputs, this section is not that unique, right? With strong government leadership and stakeholder engagement, financing and technical assistance. Those are core things that lead to the expected impact on the right. When you look at the activities, these are the elements that we consider the GFF to be accountable to specifically. As you know, the GFF itself is not an implementer. So we consider a collective accountability when we move over into the expected outputs, outcomes. But for activities, we really engage with countries to set up and strengthen that country platform, specifically to focus on data use. We really have a strong alignment agenda in country to align investors so that there's a shared understanding of what the country is hoping to accomplish. There's the development of that cost and investment case, the identification of key reforms, and the required investments in data systems and analysis capacity. And the idea is that these things will then eventually lead to the improvements in service delivery, financing reforms, and the systematic use of real-time data. There are areas that we've pulled out where we really recognize that measurement needs to be strengthened: gender, equity, SRHR, adolescents, private sector, quality and efficacy, efficiency, and alignment. And again, we adopt this contribution perspective. So the impact achieved is led by and belongs to the countries. Our approach to monitoring progress, as I mentioned, is flexible. So the core reforms sit in the domains of health financing, SRMNCAH-N, service delivery, and health system strengthening. And so for the results monitoring, the GFF is supporting our countries to identify and collect the data that best suits those specific reform areas. So at the highest level, especially for primary health care, results monitoring includes measurement of core outcomes. There's a combination of rapid cycle monitoring, supply chain and systems reforms, but diving into the data at individual country level provides a further view towards understanding progress. And so really quickly, I have 2 more slides, and then we're going to jump right into the portal itself. But I wanted to better articulate what sits in what we'll talk about today, which is the web portal here. We collect the most recent DHS and mix. These are population-based surveys, global health financing data, our resource mobilization and expenditure tracking data. We monitor the GFF engagement as well as World Bank operations in country. And then we have the country-specific data, and we bring all of this into our repository and then work with vendors and countries to develop the visuals that you'll see today. And again, this is a multi-purpose web portal. So used for country analysis, we'll show you how any of these images can be picked up and placed into PowerPoints, how any of these images can be downloaded as data tables, donor reporting, and overall analytic products. We'll circulate the first few slides of this presentation to share a little bit more about what we mean by all of those data sources I mentioned on the left. So for those of you who are well-versed in monitoring evaluation, this might not be that useful, but I do think it's helpful, particularly around the time element, for people to understand what a population-based health survey does and doesn't tell you, and how helpful it is or not, depending on how long it's been since they've had one. Coming down to the implementation progress data from countries, which is much more frequent, collected quarterly and reported annually. We're going to talk briefly about the data collection process from countries, because core to the concept note for this meeting, we wanted to be sure to answer how is the data collected and why are you collecting the indicators you are. We work with countries to develop their own theory of change frameworks. And so after agreeing upon the reforms and initiatives, the countries then selecting what are the best output indicators that represent the result of activities linked to those reforms. So I'm going to say that one more time. The indicators selected are meant to represent the results that are linked to the activities that support the chosen reforms. And then they're identifying the source of that data for each of the indicators. That outcome indicators similarly should represent the expected health outcomes the country hopes to achieve once these reforms are implemented. So just looking at this, there could be quality of care is measured by a national balance scorecard. And we know that all of these small things here, nutrition counselors report quarterly reports, those should lead to improved outcomes. And so in the outcome section, you'll see more of those health-related indicators. So total number of pentavalent vaccines administered, for instance. Okay. So with that, I'm going to stop sharing and hand over to my colleague, Jess, to walk us through the web portal. And the way we've decided to present today is to do a Q&A based on our experience working with CSO and youth advocates like yourself, and focus on potential use cases for the portal in your work. So Jess, over to you.
Thanks, Karen. I'm going to share my screen now, and let's see if this works. Can you see the homepage now?
Yes.
Great.
Yes, we can.
Thank you. Thanks very much, Pauline. And like Karen mentioned, we're going to be walking through the data portal itself. And I just want to point out 2 things off the get-go. One is that I'm going to actually be walking you through the staging website. That means this is the website that isn't yet exactly the same as what you'll see on the public version. It's in the spirit of transparency, we're going to be showing you all the new updates that we are going to be making. We keep this page with a login while we're working on it, and then we will be pushing it live, which means it will be available for public view later this month. So excuse any bugs you might see, and it might be a bit slow, but we're excited to show you this up and coming version of the site. The second thing for the translations team is that we can pop the the live site that you don't need a login for in the chat. I'm not sure, Karen, if perhaps you can access the chat at this point. And I just want to highlight that the whole page is available in English or French. So while you're walking through it, you are more than welcome to follow along as needed in French as well. Thanks. So like Karen mentioned, we'll be doing a fun question and answer session. So I'll be at Karen's mercy for any tough questions she throws my way, and then we'll carry on for any questions you might have. Thanks. Karen, over to you.
Sure. So Jess, I'm aware that there are a handful of impact indicators that a lot of our global partners are working on. How do I know how my country is doing compared to others in my region?
Thanks, Karen. So I'm going to start on the homepage of the data portal, and this gives a really broad overview summary of where we stand across our indicators. So I remember from the logic model that you shared that there are a few core impact indicators that we can look at across countries. So I just want to point out that I can choose which indicator I want to look at from this drop-down list. And I'm going to pick adolescent birth rate as the indicator most of interest to me. And as you can see, you can hover over countries to get a sense of what that data point is. And as well, I'm just going to point out that you can see, I want to move, you can see the source as well. So for Madagascar, that's coming from the DHS 2021. For other countries, that might be a little bit older. And so you can compare countries between time periods.
So Jess, instead of clicking on every single country to see the data points, is there a way I can just see all of the indicators across the years for all of the partner countries?
Sure. There's two things you can do to start. First, I was hovering, but if you click one of the countries, you can see quite a bit of information. When the country joined the GFF, information about the investment case, and then all of the data for each of the indicators for that country. But you asked about all of the countries, not just any one particular country. And so for that, I can click the download button, and I've just downloaded this here. You can take a look and see each country, all indicators, what source we're using, what year we're using, and the value in question. So that's going to give you all of the GFF partner countries and the information that's latest there.
Just
and
the
now
table's not showing.
Oh, the Excel isn't showing.
Well, while you
What
look
about
at that,
now? Am I now sharing my whole screen?
Yes, there we go.
Okay, great.
Yeah.
Thanks, Karen. And just to mention that we do work with countries to approve the data that they choose to use for these indicators. So you may see different indicators used for different indicators, different data sources used for different indicators. That might be because one survey is used for some indicators, but not all. And we work with countries to identify the sources that are most of interest to them and most used for them.
Thanks, Jess. And just a point of clarification, the indicators we're showing on this homepage here, again, are the impact indicators. So these are not all the country indicators they submit to us.
That's a great point, Karen. And actually that brings us down here to the logic model. This is the same one that you showed on your PowerPoint slide. So this is showing the distinction between what we would expect all countries to have data for, which are really those core outputs and activities that we work on with all of our partner countries, compared to the outcome indicators that we would expect countries to start reporting on after at least 1 year of implementation. And we'll look at some of those later. What I was just showing are really these impact indicators. These are the ones that we would start seeing impact or change over time for just those countries that have been implementing with the GFF the longest. So it's really just limited to this right-hand approach here on the impact side.
Great. And if I want to know how long my country has been implementing its investment case, where would I find that information?
Great question. You could find that in one of two places. First, if you click on any one country, you can see the information for that country here. So for Côte d'Ivoire, for example, they joined in 2017 with the GFF. And then you can see information about how long the investment case has been implementing for. So the current investment case in Côte d'Ivoire is applicable for 2020 through 2024. And there's a link to the investment case and the project document right here. A little more information about the World Bank project as well, including the IDA commitments and then the impact data. You can also see that information on a country profile, and we'll go there next.
Thanks. And then if I'm interested in whether or not GFF countries are making progress across nutrition outcomes, for instance. So I work in a country where nutrition is a priority. It's challenging because it's multi-sectoral. We work across a number of different ministry departments. I want to know which countries are doing well in those so that we could support cross-learning and engage from my country. So how would I find out where we're making progress across nutrition outcomes?
Great question. There's a couple of places you could find that. First, you might start by looking at stunting rates across all of the countries of interest. But this shows you only a snapshot in time, the latest point for any given survey. You asked which countries were showing progress. Like you mentioned, this also only relates to that right-hand side of the logic model, the impact data. The limitation, I think, as we all know with survey data, is that it's not collected all the time. Usually surveys are every 3 to 5 years, so you might not be getting the most up-to-date information. Like you showed in your PowerPoint slides, there are other ways that we measure and collect data, including through routine monitoring data from countries that have been implementing for 1 or more years. And those are done through those country data requests that we submit to countries annually. Scrolling down here just a little bit further, we come to a section called Progress against the GFF logic model. And this takes each of those color-coded sections, output, medium-term outcome, long-term outcome, and impact indicators, and looks at which countries are making progress against expected outcomes. So you asked about nutrition. That's an outcome indicator for us. We were looking at which countries might show improvement in, let's say, 75% or more of nutrition outcome indicators. We have to group the indicators this way because each country's specific priorities, specific investments, and programming is going to be depending on that country's situation, on their context, and what their biggest needs are. And so therefore, we don't just talk about one nutrition indicator. We understand that countries have many ways they're measuring progress against their nutrition programs. So we look at which countries are prioritizing nutrition in their investment cases, and then which ones are actually showing progress in 75% or more of their specific nutrition outcome indicators. So last year, there were 11 countries prioritizing nutrition, and 8 of them were improving. This year, more countries started investing in nutrition, and 9 are showing improvement over time. And that's the list of countries you can see here. And in a couple of weeks, we'll be making one more line here that shows the ones that have been improving more recently. But this shows you the countries that have made progress in 75% or more of their nutrition outcome indicators. You can also take a look across other programmatic areas, and it's an interesting way to look and see who's prioritizing what, where is their progress being made. The other thing I would point out is that there are also health financing indicators shown on this site throughout the various components of the logic model. And it's an interesting a place to look around and see where progress is being made across the various places in the logic model. Now you could finally take this to get a sense of which countries you wanted to dive deeper into, and you can find out more information about which indicators are prioritized and where is their progress in nutrition for any of these indicators by clicking on their country page.
So speaking of country page, my country is revising their investment case, and we need to examine the financial inputs from government and donors. How would I know whether that landscape has changed over time and who is funding the most?
Great question. Like I mentioned, there are some health financing indicators here, but you'll want to know way more than just how many are improving in these areas to get a sense to answer your question. There are a couple ways we could go to country pages. You can see all the GFF partner countries here, but I'm going to go up and take a look at the list of all of our countries on our country page. Karen, you work on Uganda, so let's start there. So here we've landed on a country page. There's some high-level statistics up front, and I'm just going to walk briefly through some of the things you can expect to see on this page to help you answer your question fully. So to start with, you can see a little bit of high-level information about Uganda's partnership with the GFF here. Joined in 2015, the investment case and links to the investment case, as well as the World Bank co-finance project date and IDA amount. You can also read a little bit more detail about the partnership and the catalytic role of the GFF in Uganda, with some focus on interventions and reforms that are of specific interest to that partnership, including a focus on adolescent health and human capital. I'm going to skip that for now and go down to a few more things that might be of interest as you're answering your question. So to start with, this is a drill down of just Uganda's impact indicators. And I want to highlight a few things here. Like we mentioned, this starts with the survey data, and that's coming mostly, as you can see down here in the source section, from the DHS. However, we recognize that there are also important estimates that are used by our countries that go beyond the DHS. Again, the limitation with some of these population-based health surveys is that they're not done very frequently, usually every 5 years. Here you can see that we also link to some coverage estimates by some of our global partners. So that's World Bank data, we have child mortality data, and WHO data as well for some of our core indicators. And those are population-based estimates that come out much more frequently. And we're working on collaborating further with WHO on that. Now, there's also health financing indicators. These ones actually start to show you how much government budget is allocated to health, execution rate, and more information about budgeting and execution. Each of these has the source located here and more definition about the frontline providers information. Again, all of this can be downloaded as well to Excel, so you can start looking more at the data. We also show some coverage estimates, again, using the DHS and other population-based surveys. All of the sources are listed here, and you can drill into any of the indicators. But you were asking specifically, Karen, about some of the commitments by donors to the program. So here we come to the resource mapping section. This shows really how much budget is being allocated by each partner to help finance the program as documented in the investment case. And you can see here that Uganda has resource maps for fiscal year 18, 19, and 20. So we can start to look at some of the changes over time. So you might be interested in understanding how the total amount needed to finance the investment case has changed over time, how much the government has invested, and then each of the various partners, you can see here their investments. And finally, the funding gap. For Uganda, it looks like the total amount has gone up a little bit in FY20. And so therefore, there's a slightly higher gap. That would probably be of interest to you if you were working with your partners. You can also download all of this data to Excel so you can take a look at how that all plays out without hovering over every single little section here.
So my next question, Jess, is about how I, as a CSO or youth advocate, can better engage with my country platform meeting. And the team that I'm working with wants to examine sub-national progress prior to and since the onset of the COVID pandemic. How can I do that? And specifically, how can I see the prioritized geographic regions that I'm working in, how they're doing compared to the rest of the country?
Sounds good. We'll start by just showing off one more component here, which is that you can change countries by clicking on the Uganda arrow, and then you can see again all of the GFF countries. So I'm going to go to Tanzania. It's been a little bit slow, so I have that page loaded here. And I want to just show that we were previously on the country profile section. If you click here on implementation progress, this is where you can get a really good sense of some of the routine monitoring data by the country. So everything else here is going to be very similar. We had the catalytic role, the impact data, health financing, resource mapping. And then down here in implementation progress, we can start to get a sense of what routine monitoring data is provided by the countries. So for Tanzania, I'm going to look at a few things here. First, we can see the indicator name. This is actually a drop-down menu. You can click here to see all of the indicators that Tanzania included in its framework and its theory of change by programmatic area. So you can look for the data of interest in one of two ways. You can either type in the search bar and you'll get a sense of what is available, or you can really go through and look at the programmatic area. You might be interested in health financing or health system strengthening. Let's stick for now with this indicator on institutional deliveries for the purpose of this conversation. But there's a lot of data in there, including on nutrition and SRHR or family planning. So when I'm looking here, I can see a few things. This is showing me subnational data, and it's showing me data over time through 2021 from the baseline year, which is 1 year prior to the investment case. I can also look at that data quarterly if I wanted to get an even more granular time trend. We can stick with annual for now. There's a couple things that are interesting to note here. First, you can take a look just at specific time periods of interest. You may be interested to see how your subnational units fared in the context of COVID, for example, or you might be interested to see how they've improved since then, or you might want to see the total trend over time. Either way, this is an interesting case study of a country that had been improving a lot and then maybe took a hit in the context of COVID and has been increasing since then. You were asking about your priority regions of interest. A lot of the investment cases prioritize specific regions or districts or states. And those that do, we offer this mapping here so you can take a look just at the specific areas that are of interest to you. You can add up to 5 of them on your graph so you can get a sense of which ones are increasing or decreasing over time. I'll click that off for now and just show that you can click even deeper into the council region or the council section. Not all of these are coming up. I mentioned we're on the staging site, which is a bit buggy, but this gives you a really granular look at exactly where there has been progress or where maybe there hasn't been progress over time. So you can get an even better sense of programming and you can select specific councils that may be of interest to you as well.
Thanks, Jess. So I noticed when you move the time trend on the right, it changes the colors on the map. What do those colors mean?
That's a great question, Karen. These are showing the percent change over time, and it auto updates depending on what you pick as your baseline and most recent year. What does that mean? That means right now, in each region, you are seeing the percentage change between 2021 and 2015. That's because Tanzania joined the GFF in 2015 and started their investment case in 2016. So the baseline year is one prior. But let's say you're interested just in the most recent year. Of course, the time difference is going to be a little bit lower because you're only looking at 1 year of implementation. It looks like Tonga increased 18% in the most recent year alone, and other regions maybe decreased a little bit, and maybe there's more to look into there. You can also see ones that increased barely at all or various different levels of improvement. Down here, the legend shows the color coding so that the highest increase is the darkest green. And if there's any regions that have been moving backwards a little bit over time, that's going to be a darker red. It doesn't look like we have any dark reds here, but a smaller increase, which is reasonable for only 1 year of implementation.
So Jess, if I've selected a number of regions or councils over a number of years, instead of looking and hovering over all the data points in the graph, is there a way just to download the table?
Absolutely. You can get a sense of the table just by, you can download all of the data here, and this will bring the council level data for your indicator in question. So that's a quick way to download directly into Excel. You can also expand this to get a better sense of your regions in question. And here, this is a chart. This can be copied and pasted into a PowerPoint if you have one, or you can take a look at it as a table. And all the regions you've selected will show up here.
Thanks. So I support my community to ensure that our most at-risk population has access to quality health services. You've shown me, I think, how I can see my district or LGA or state or region, how they're doing compared to others. But is there more to understand with regard to one of the big bottlenecks to access, and that's budget, ability to pay? And if my government has committed to spending a certain amount of its budget on health, how do I know if that's been done?
Great questions, Karen. So first, you asked about access to quality health services, which, as you mentioned, is linked to several bottlenecks. So the first thing I just wanted to mention is that we do also have health system strengthening and health financing indicators that are reported on an annual or quarterly basis here through the countries. So the first thing you might want to look at is, say, tracer medicines, which we don't have subnationally, but is helpful to look at the trend and how availability of commodities is going in your country, which may help address one or more of your bottlenecks. So first of all, you can start with looking at some of that routine health financing or health system strengthening information. That would be one of the places you can check. Additionally, in terms of access to budget information, you can take another look at the core health financing indicators here. So you can look at the share of the government budget that's been allocated to health, as well as the health budget execution rate for your countries of interest, and the sources are listed here.
So for instance, I see in Tanzania that the share of budget going to health is going down. And I also see that out-of-pocket spending is going up. Is that a fair assessment of this table?
That is a fair assessment of this table, yes. Yeah, you can take a look and see how these indicators may or may not be linked. And I would mention too that that's, yeah, I would look at the source as well for these data, and you could see the relationship between those indicators. I'm going to show you one more area where you can look at this data and you can look kind of across countries. We've been focusing so far on the country-specific pages. We also have key themes. These are thematic areas of interest that you can dive into for some more detail. We have some that are already created and some that will be coming in one of the future releases. You asked about health financing, and I think there's more to look into here. So the health financing page starts with the overall approach that the GFF takes to health financing in its countries. And then we have country profiles. So these will show the overall narrative of the health financing situation and background in the countries, and you'll be able to look at it across countries. So let's pick a country to look at here. I'll pick on Burkina Faso. And you mentioned, Karen, about primary healthcare spending, I believe. Let's look into this graph. What do you notice first, Karen, and what might you pick out from here that's of interest for your country? You might look out and see that the primary healthcare as a percentage of the global spending is among the top for its peers. And you can see other countries in sub-Saharan Africa, and you can see your country of interest, Burkina, and how it compares to some of those other countries. You can get this for primary healthcare expenditure as well as domestic general government expenditure on primary care as well. So these are two areas that might be of interest to you. You can then go back to the country if you wanted to go straight to Burkina's page, or you can continue to explore where those health expenditures are going by looking at several indicators of interest here.
Thanks, Jess. And then lastly, in my country, we have a really high rates of early marriage and early pregnancy. And if I want to better understand what subnational areas have the highest rates of early marriage and pregnancy, where would I find that information?
I'm going to go back to key themes. There's a couple of places you could find this, but we have a key theme just on sexual reproductive health and rights. Overall, the page looks very similar to health financing. We start with the GFF's approach to SRHR, and we have downloadable SRHR briefs for each country. These were developed by the SRHR team at the GFF. We also have a focus here on adolescent health analysis, and this one is intended to really drill down to the SRHR needs of adolescents while also looking at how they differ across countries. So I'll go to Ghana. I know that's another country you work on, Karen. And I want to point out there's really a lot to dig into here. The sources for these come largely from the DHS, and there's also other UN data that's shown on here. You can see all kinds of SRHR information for your country of interest, including age-specific fertility rates, population information, and then we can really drill down and get a sense of each of these areas. You asked about teen marriage, and I think this is one area that there's a lot of information on. So we have information on early sex, marriage, and birth at each age group. You can see by subnational level, girls who experienced each life event by age. So these are by 15, marriage, birth, and first sex. And this is a subnational drill down of that data. You can see the distribution on sexual activity and timing of childbearing. And then you can also drill down to each subnational level to get a sense of that distribution by activity and timing of childbearing. This is really interesting if you want to take a look at where you could help provide more services with your team.
Thanks, Jess. So with that, we've ended my scripted Q&A session to walk through the portal. And I hope we did our best to represent some of the questions I think some of you may be interested in. But we wanted to make sure that today was as much a discussion as a presentation. And so, and sorry, I have my young son on my lap. I wanted to open it back up to Pauline and Vincent to share the floor with our colleagues on the line. And we're happy to answer any questions and also take suggestions. Again, many of you are sitting at country level, and this is meant to be a tool to best serve the needs of you as well as other country stakeholders. So if you have ideas, I just want to remind people this has been up for only a year, and we're definitely crowdsourcing ideas on how to make this more user-friendly and applicable to the settings in which you work. Thanks so much.
Thank you so much, Karen and Jessica, for that presentation and walking us through some of the questions that, will be of concern to advocates on the ground. So I'm opening this session up for all of you on the call to ask questions. You can raise your hand and you can have an opportunity to ask your question. But also feel free, if it's easier, to put it on the chat. I've already seen one question and it made me sort of think about it in a round way. Jackie, I'll come to you in a minute. When you do country data, do you cover the whole country, all the sub-national geographies, or do you only end up covering the priority areas? It was a question from Uganda, but I think it would be beneficial for everybody on the call. And we'll take a few questions and then we can have Karen and Jess answer those questions. So Jackie, over to you. Jackie Katana.
Thank you so much. This is really great, and we are very excited to have this data as a point of reference. My question is based on what Esther asked regarding subnational data. In terms of reliability, because when you look at how data flow is in Uganda, from the district health information management system to the health information management system at the national level, we find that there's a lot of disconnect. And that's why some studies, we prefer to do action research to give us the latest data, to sit with the biostatisticians and try to analyze data that is in their system vis-a-vis what is the national, and we are able to triangulate. So how reliable is this data that we have in our portal, that we can rely on it without doing action research to inform our design and implementation of projects? Then the other question is on Yes, you said it's based on population-based surveys and other authorized surveys, but how flexible is it to use other surveys and other sources of data? Like, for example, in Uganda, the latest data now is from PMA, and we find that it has much more updated indicators, only that we quote it with stars because we know that we're obliged to refer to authorized population-based surveys. Thank you, over to you.
Thanks, Jackie. I'm not sure that I see other hands, but both Karin and Jess, I think you can answer those two. But before you answer, I want to add a single question. When I looked at a country like Kenya, the DHS is very old. It's 2014. There's much more recent data from the National Bureau of Statistics, the census data. How easy is it for this to be updated? Is it going to be reflected when you do the full updating of the system, so that people are working with more current data? And especially because when COVID happened, there were changes where countries could have been doing well. Some indicators may have changed in the negative sense. How are we doing for that? Answer those, and then I'll come to you, Aliyah.
Great. So I'll start with the question in the chat, which was, are we showing subnational level for just the priority projects? Okay, sorry. Jess, I'm going to hand to you really quickly while I take care of this one. I apologize.
No problem, Karen. So to answer that question, we do show all districts, not only project districts, especially where that data has been made available. So we actually do work this. I may also answer this question partly by answering Alea's question about who provides that data. So the data does come from the HMIS office in most countries, where we send out the data request letter to the HMIS office directly. And so the data is then shared back by the country to the GFF. We request and report out data for the whole country across all districts. And you can use that priority districts dropdown to select then any districts that are RBF districts, if that's one way that the country prioritizes, or the World Bank project includes a distinction. Some countries like Liberia, you can also select even other donors like USAID districts or priority districts in the investment case. So the way that we differentiate between districts depends in part on how the country itself prioritizes. There are some indicators for some countries where the data source isn't the country HMIS, but the country uses, say, its PBF reporting or other reporting. And then in those cases, it will just be for the districts of interest to the PBF program. Those are rare cases, and we usually try to ask for the data across all districts and then focus on the districts of interest. But there are some in Nigeria, for example, some in Bangladesh, where the DLI data is only for a few areas of interest. And then that's reflected on the map by showing only those districts. Those cases are rare, and we're really working with countries to try to include all data for all districts so that those RBF or other priority areas can be compared instead of just shown on their own. So it's an ongoing thing we're working on, but the goal is to cover all districts, and for almost all of our countries, that's what we do. Karen, I see you're back. I don't know if you want to jump in on that or any of the other questions before I come back in.
Well, I wanted to get to Jackie's question because this is a popular one, which is, we're using countries' routine information. When I say routine, again, the difference between the population-based survey, impact level surveys, studies and reports and evaluations. This is the routinely collected data from health facilities that goes into a country's national health repository. And many countries are using DHIS2. Are there quality issues with the data? Absolutely. That doesn't mean we don't use it. And what I mean by that is, no, we're not going to use bad quality data to make informed decisions about budget and policy decisions. But we are looking at the information that the country sends. We examine it for outliers, examine it against the trends over time. And we use this as a way to flag the necessary TA to engage with countries to strengthen the ability to routinely monitor implementation. The solution for countries is not to fund evaluations and surveys, because by the time you get that data, it's really too late to impact decisions that need to be made at the facility level. We feel, in collaboration with our other partners and the country stakeholders themselves, that countries feel better going back to the questions that they consider priority questions and using routine data to answer those questions. And so putting this up on the website, we've been told, is an air quote brave choice. Is this the best way to move forward? Absolutely, because there's no other way to see the difference in geographic equity, the difference in equity across target populations. So as we strengthen some of the core routine indicators, you can also start disaggregating further by age, by sex, by geography, and really start answering the question about, are we reaching the most at-risk populations? Are we improving health outcomes? So you can have any type of survey about how well, this evidence-based intervention works. But the answer is found in the health outcomes. And unless you're looking at the routine data, you're not going to get those answers. So we feel strongly in partnering with our countries on establishing data strengthening and use work plans. And we've collaborated with others in this space: WHO, Countdown to 2030, Bill and Melinda Gates Foundation, Gates Exemplars. There's a lot of, I often say there's a lot of flowers blooming in this space. There's big push to go digital right now. And we're really saying, let's take a step back and look at the quality of your data before you go digital with it. And there's a lot of double funding of initiatives in this space. So we work really closely on alignment of donors, not just around the investment case, but around the data use work plan as well. What systems need strengthening and what competencies need to be built. There are a number of countries we work with that don't have the skill set to pull down or develop an API in DHIS2 and perform the necessary analysis. So those are all spaces of ongoing work, but absolutely we support the use of countries' routine data. Pauline, your question about the population-based surveys, absolutely, that's why we put the years there. There's big gaps, but you'll also see just highlighted under the impact indicator section, we're linking to estimates, right? So for those of you who are familiar, estimates also use the population-based survey as an input, but they're updated more frequently on an annual basis. So for those core indicators that we're all looking at globally to monitor progress of the SDG 3 in particular, those mortality rates are often assessed with estimates, and we've linked to those. So our website is not supposed to be creating new data, but linking all in one spot where people can go to understand the status of the country in which they work. Thanks.
Thank you. I think that was really a good point, that you're actually helping people to have a more centralized point where they can access data. And that's important because then it saves people time and it helps in figuring where does this data come from. Sometimes people aren't aware. So Aliyah, ask your question and then I'll ask a couple that are pasted on the chat. Then we can come to you, Jacob. So Aliyah,
thank you so much. Thank you, Pauline. I would just start by appreciating. It's a really great initiative and very much needed, I should say. So my question is about the missing data or the data gaps that often comes up in different countries. We know that it is not perfect. So what is the strategy and what are you doing to do something about that? And the second one is, will you be adding more health and nutrition related indicators into your data collection or data mapping thing? Thank you.
Thanks, Aliyah. Jacob or Jakob, do you want to go next and then we'll take both questions?
Jacob? Mubi? Okay, go ahead.
Okay. Thank you so much, Pauline. and Jessica Brown. That was a nice presentation. My question is about how do you ensure that that data posted by countries on the portal is verifiable or valid data from those respective countries which are posted? Thank you so much.
Thank you. Karin, let me add two more. I think one or two. Carrie asks, are there any plans to strengthen the HRH data as part of health system strengthening or PHC priority areas? So that's a question. If you can get going those, we'll pick up another set.
I got the HRH strengthening, the validity from Jacob, and Aaliyah's question was about whether we're adding more indicators. Is that right? Okay. So Aaliyah, this is, I'm going to link your question to the HRH indicators one. The indicators are limited on the site to those indicators the country has selected to best represent the results linked to their prioritized reforms. Does that mean that next year you won't see additional indicators? No, but it does mean that there's a focused intent on understanding if the financed reforms and inputs are working. So right now, you know, countries have more data than they know what to do with. And it's really challenging to think through how you bring all of this information together in one place. And so again, we always start with the question, what question are you trying to answer? And the GFF engagement is really focused on linking to an integrated systems approach to move the reform agenda forward. So there's the health financing reforms, service delivery, and health system strengthening. What we did this year that we hadn't done in the past, and you'll see this come up in the key thematic areas with additional analysis, this was the first year that we required 11 core routine indicators. In the past, because this was country-led, we said, oh, you guys pick the indicators that are most useful to you, but then it makes it difficult to compare across countries using that routine data. So we referenced the WHO monitor definitions for 11 core routine indicators to collect from every country. So those are ANC4, stunting, assisted delivery, Jess, help me remember the 11, but it's the standard 11, postnatal care for mothers, postnatal care for newborns,
Breastfeeding, couple years protection.
Years protection, and kangaroo mother care. So that's something that you'll see across countries. But on the HRH strengthening one, there's two things going on in this space. I think from a system strengthening perspective, we have engagement at countries where we're strengthening their overall HMIS roadmap, and the use of IRIS, if you guys are familiar with that, for tracking some of those HRH indicators is popular in many countries, but they're not necessarily using it all the time. So we have honest and frank conversations about, if you're not using this system, why not, and what works better. Whether or not a country submits those data to us doesn't make as much difference as it does to us that we're strengthening the ability of the country to use it. So I hope there's that distinction. So we aren't requesting HRH data from every single country. The country is selecting some HRH indicators to best represent initiatives that are funded. But we are working with countries to strengthen the systems through which they try and collect and use that data. I think particularly as we're moving into the space of service delivery redesign and reform, you see a coming together of the need for that HRH data, as you know, to link back with facilitating hub and spoke models, making sure the right staff are in the right locations for the right populations, for the right service delivery models. How is that staff receiving its funding through either insurance schemes? So the HRH data is for sure a priority piece in every single country to realize the reforms they're talking about. we don't require that countries send us all HRH data. It links back again to how they've prioritized their theory of change. So I hope that answers. And Jacob, I think I was trying to answer your validity question in the previous one that came up, but there is a review process with the country. You know, they're sending us the data. We quality control, quality assure, look for outliers. We go back to country before anything is published on the website with the data set, and we're showing how it's visualized and say, are you sure this is really what's going on here? And so it's a nice opportunity to have a conversation with countries about data quality in a way that often doesn't occur. You know, instead of passing back and forth spreadsheets, when people see it visualized, it's really apparent that something is off. So for the validity of the data, I would say we do have our QA/QC processes in place, and we work with the countries on whether or not to include the indicators or not after they've been submitted. And then if we do find data quality issues, then that again is a flag for technical assistance in this space to strengthen the data. That is a question. Jess, would you add anything else?
Well, the only thing, thanks, Karen. No, not much. The only thing I would add is that I think there are two questions in the chat that also get at this, that I think it might be interesting to dive a little bit more into that relationship with the country throughout the life cycle of the data collection and then reporting process that can help both with the question that Asan added in the chat from about Senegal specifically, that again, we can talk about the broader process rather than just Senegal. And then Alia's second question about addressing data gaps and missing data, possibly kind of throughout that life cycle. So I think the first question is that, like you mentioned at the very beginning, Karen, the data, the indicators are selected based on indicators that the country already is using to monitor progress of the investment case in the investment case results framework. And then in addition, there are health financing indicators and indicators sometimes from the World Bank co-financed project. But a lot of those data are already based on indicators that the country has selected as part of the investment case results framework. And so as part of that collaboration process with the country platform on that. So it's usually a subset of indicators from the investment case results framework or the World Bank project that are then packaged. And Monique, the director of the GFF, then sends out a formal letter to the Minister of Health or Finance or other that then establishes that relationship on an annual basis to formally request the data to be shown publicly. So there's a formal relationship between the GFF and the ministry regarding the request for data that outlines then that list of indicators that will be requested. And so then from there, there's an individual that the ministry names as usually someone from the HMIS department, sometimes other departments, as the core point of contact from the government. So it depends on the country who that person is, but it's usually somebody in the ministry or the data HMIS department. And then we work back and forth with that person. They share the data. And then as Karen mentioned, it then goes back through for formal approval before any data is published. Where we are right now is the beginning part of that last process. So the data we shared now has not yet been validated by government. Anything public is validated by government before it goes online. So hopefully that helps with the Asan's question on Senegal as well. And then maybe we'll pause on data gaps because that might work also with Vincent's question in the chat. But Karen, is there anything you'd add on that process? Hopefully a little bit more detail helps there.
No, super helpful. Thanks, Jess.
Thanks.
All right. Thank you so much also for focusing on the questions that are on the chat. I am not seeing a lot of questions from our French-speaking colleagues, so please don't feel constrained because of language. You can put it down here. We have sufficient translation, but also you can raise your hand and ask a question. But I'm wondering whether there are any other questions that colleagues have. I'm not seeing hands raised unless I'm missing someone.
Pauline, is now a good time to come in on Vincent's question in the chat as well?
Absolutely, go ahead.
Vincent, this is such an interesting question because this does happen. And perhaps this will also get to Alea's question on the data gaps and missing data. But yeah, there are cases that we see where sometimes conflicting data comes in, and that can happen depending on the data source. As Karen spoke to in detail before, there are sometimes, issues with the HMIS, or there are very valid reasons like timing of a survey that there might be data that, it's valid that it doesn't really line up exactly. And it would be confusing for us to just post it on the portal. So going beyond the data portal, this is something that the GFF is working on addressing in collaboration with countries and some of our global partners as well. And I just wanted to use this time to highlight a collaboration with Countdown to 2030. So together with Countdown, the GFF actually even held a workshop this past summer to really try to focus on data quality and specifically on the sometimes contradictory, sometimes helpful relationship between surveys and routine monitoring data. Using routine monitoring data to estimate out coverage, comparing that to surveys, really digging in together with academic institutions and ministry colleagues about why that might be in a country. What is the role of the private sector in some of those gaps? What is the role of some of the denominators and census questions that we have? Why might there be this mismatch? And so the goal wasn't only to produce a valid coverage estimate, although that was produced as part of these, and countries are still working on refining those, but to start asking the questions and really encourage the teams and empower them with tools to try to address why those might be in the future and think about what can be done to improve upon data quality. We believe that posting data on the portal increases transparency and that really can help drive improved data quality. But we also want to work with teams on the tools for how that might be done to reduce those kinds of conflicting data in the future. In the short term, and just for the portal, we do bring those to the attention first of the GFF Secretariat focal point and liaison officer and other members of the team to bring in country team members as needed to address specific instances of that for the short term. But in the long term, this is part of a much bigger initiative around data quality and data use at country level that we're keen to work with teams on.
Well, thanks for that. I see a question from Kenneth. In Cote d'Ivoire, we have some difficulties in accessing data on the impact of GFF on youth health since 2017. You have to send an official letter to DIS and wait. Is this type of data available on the portal? And then a follow-up question from Jackie. How often is the data in the portal updated? So if you can zoom into those two.
Kenneth, I can take Cote d'Ivoire to start off with. Yeah, there's a lot of benefits to the data being from the country and country-led, but we don't have any special access within the DIS. We only use the data that is submitted by the country. So you can take a look at what's on the Cote d'Ivoire page, but frankly, some of that data is missing subnational recent data. We have subnational data for prior years, because the subnational routine data isn't usually approved in Cote d'Ivoire until almost a year later. So that data comes with a bit of a delay. We do have some indicators on adolescent health, but they'll only be approved to be posted publicly by the government in some cases. And so I don't think we have any special access beyond what can be received, although I think it would be interesting to continue working together on this because adolescent health is a really important part of the reform agenda in Cote d'Ivoire. So in short, no, we don't have DIS data on the portal. We usually use HMIS data, but even that comes sometimes with a bit of a delay from the ministry. And so we want to be very careful to only report what the government is comfortable sharing online publicly. The portal is updated twice per year. but there's a lot of detail in that. So I'll look to Karen after I go as well. We update the country routine monitoring data 1 time per year. We still show data quarterly. So we request and often receive data from countries quarterly, but we put that update up once annually. So you'll be able to see later this month, all 4 quarters from 2021, but we're not updating the portal each quarter. So it comes in at a frequency of once per year, periodicity of quarterly for the routine monitoring data. Twice per year, we make modifications that include updates to any survey or global impact data, and as well to the key themes and other programmatic area updates. So we'll essentially make updates to the site that allow for more interesting analysis and more information using the data that was available as of each fall. So October usually of each year. Last year we published in November, and this year we're hoping to publish in October of this year. So the routine monitoring data updated once annually with 2 yearly updates to the site overall. Karen, I'm sure that was a jumble. Would you come in there?
No. I think the only thing I would add is, because the next question would be like, why are you only updating once a year? And I want to emphasize that the GFF Data Portal is a place to come for stock taking. What happened in the last year? How are we doing across health financing, health system strengthening, and service delivery? We want to leverage existing systems and processes at country level. So it is not the case that we want to turn into a reporting institution where countries will have to report up to us like a donor, for instance. What we want to do is use the portal as an example of how we can bring some of this information together, highlight where there are gaps in information, work with countries on strengthening their own systems, and core to the work plan in the work stream that Jess and I sit, which is our results, knowledge, and learning. The reason why the GFF positioned our engagement around a country platform, the alignment agenda, is to really recognize those groups in country that come together on a quarterly basis to review information. Each country has their own process right now for the collation and collection of information. Few countries I've seen have a routine process through which they analyze, visualize, and have a standard report that goes to that group of people. And so this is another area of collaboration. I'll give you one example. So many of you might be aware UNICEF came out with the SRMNCAH scorecard app that was in DHIS2. It was picked up by some countries, but not others. And it had some limitations for how you could even set targets at subnational level. What UNICEF has done now with funding from Gates that we're also aligning on is they have an SRMNCAH-N app that enables countries to utilize their own indicators of interest, set up that API so that there's some competency building at country that can go on where they can just push the button in DHIS2 and get that routine report. So there's a lot of indicator mapping that goes on. So for every indicator definition, every country may have a different indicator name in their DHIS2 system. And so how do you engage at country level to start mapping some of those indicators and make it easier to access the information, right? So I think that it's a two-pronged approach. It's not just pulling information from the system, but we need to systematize the way in which countries can access their own data, and we need to systematize the way in which countries can talk about it. You know, what skill set is in countries sitting in the Bureau of Statistics or DPPI that can pull it together in a visual way. So just to emphasize, we on purpose are not asking countries and giving them homework assignments to send us data every quarter. We're doing the stock taking once a year to see how things are going, but our engagement at country level is where we really want to work to use the routine data for decision making. Over.
Thank you for that question. I'm not seeing additional questions unless I'm seeing something, but I have a question of my own, and it's around the support to countries to improve their own data systems to what extent are you working with countries, not just to hit the district or county or provincial managers, but also to put, to push further for utilization of data at source. Data is usually generated through health facilities or service provision points. How is the GFF supporting that level? Because many times that level will miss to use the data, yet they're the ones generating it. And where they have a level of planning they have to do, how are you working with that level, or what sort of guidance are you providing to countries to support that, or working with partners already doing data in these countries to move use of data at the point of the source?
Thanks for that question, Pauline. Yeah, I mean, you're speaking to my mantra, which is data is most useful at the point at which it's collected. You know, that's where the decisions happen and where action needs to be taken. My broad statement is, again, we want to work with existing systems and processes. So in a couple countries, I'm going to give you a couple examples because it's not the same everywhere, but in a couple countries, we have worked with them to establish what I call a data use and interoperability assessment. So one is, you know, at each level, at facility level, what questions are you trying to answer? What indicators would you need for that? And where is that information coming from? At district level, the same, and at national level, because the answer to that is different at each level. I mention this because a number of countries are really into moving into like, we need a national repository and a national dashboard, but we're always saying like, this is bottom up. Like, what do you need at community level, at primary healthcare level? Because as part of service delivery redesign, we're saying this is where people are being taken care of. And how are you using information at that level? So what I see in another country, for instance, is you have paper-based records that community healthcare workers are using, not just for referrals, but also as malaria management or TB checkups. You know, how are you incorporating that into your DHIS2 system? And what reports, again, there's a lot of pushing information into this repository. There isn't a lot of how are we getting it out to answer questions at what level. So I'd say more broadly, we're working with countries on their overall system for data use, not just the data collection. And then in a Ghana example or a Uganda example, they have really strong DHMTs that meet regularly and are responsible for pushing back to facilities information. The way I see that being pushed back facilities in many cases is this is where you're not doing well. It's not the case that facilities are being given a nice report that shows how they're doing writ large. And so there are little things to tweak. I think it's the wrong approach to suggest new ways of doing business on the whole. But again, leveraging what already exists in countries where there's already the people coming together and some type of line of communication and systematizing that. So how do you take what's there and institutionalize it once it's made better? So that's broad brushstrokes, but does the GFF have a strategy for engaging at facility level in every single country? No. But our jumping off point is that overall landscape assessment.
Thank you. Another one is on health financing. Health financing is a function that goes beyond the Ministry of Health. The decisions around financing are made beyond the Ministry of Health by, the Ministry of Finance is a major stakeholder, but also non-health and non-technical leaders like political leaders are very critical in overall health financing in countries. How can the GFF Data Portal be a good tool for advocates to use to engage the non-technical decision makers, whether they are in the political arena or in other spheres, but that have a very strong bearing on how health is financed, and especially as we push for domestic financing for SRMNCAH?
Thanks. That's a really important question, and I'm going to double down on that and be even more succinct. And I realize we only have 1 minute left, but it is always the case the Ministry of Health does not make the decision about the financing. And I think everyone should be aware of how important that engagement is with Ministry of Finance and how you can start making the case for additional funding towards health you really have to look at a couple things. Number one is not every country is in a position to mobilize more resources. So domestic resource mobilization.
Davantage de ressources nationales.
Sorry.
Yeah.
What I can do, Pauline, because I know we're at time, is I can paste a little bit of a summary on the health financing piece, because that's an area where I think people are intimidated by and don't know how to talk about or engage on it. But I can just send that to you to circulate if that's helpful.
Yeah, if you would send that, it would really be a critical one. And I want to take this opportunity to thank both Karen as well as Jessica for taking time to join us and to walk us through the portal. I think this conversation it's just beginning, so we may come back to you for future conversations around data. And thank you very much for taking your time. And also to all the participants, thank you so much for your interest and questions. That has kept this really exciting, and feel free to send additional questions either to myself or to Vincent. I think Vincent did the invite. A lot of you have my email from all the engagements. Feel free to reach out to all of us and we can get these questions answered. I'll just make one quick mention. We've developed a quick matrix that will help you navigate these data resources that will be shared as well. So be on the lookout for that link. And with that, I'll hand it back to Vincent for the final wrap up. Over to you, Vincent. Thank you.
Pauline, thank you. Thank you so very much on behalf of the co-organizing partners. So the Global Financing Facility, WHO, Countdown to 2030, GHV, PASS, and ourselves at PAI, as well as on behalf of the CSCG. I would like to thank very much Jessica and Karen for your great and presentation and insights. Thank you so much for taking the time. We hope that it is an ongoing conversation, and we'll be happy, if appropriate, to share your contact details with the meeting participants, as well as, if appropriate, a recording of this webinar for those who were not able to attend. And with that, I would like to thank also Pauline so much, and all the ones that were behind organizing and making possible this webinar. We will get back to you on the second session of our data webinar series that will address the other data sources that are available outside of the GFF Data Portal to address SRMNCAH-N issues in your country. So all the best in your respective activities, and thank you so much for staying a little bit more. We'll get back to you very soon by email. Thank you all. Merci beaucoup. And au revoir.
Thank you.
Bye-bye.
Thank you.
Asante, Pauline.
Thank you.
Thank you.
Bye.
Thank you. Bye.
Thank you.